Welcome to another episode of 30 Minutes with dailystraits.com, where we delve into the insightful discussions of topics that matter. I am your host, June Romney, and in today's episode, we are joined by Dr. Paul Coceancig. Sorry if I got the name wrong. You can correct it later. Sorry about that. A pioneering maxillofacial surgeon known for innovative work in treating sleep apnea. So, our Dr. Paul is here to shed light on an increasingly relevant topic in dentistry: the distinction between therapeutic dental treatments and the rapidly growing field of cosmetic dentistry. Amidst the Reserve Bank of Australia's concern about rising health costs, Dr. Paul will discuss how cosmetic procedures like dental whitening and veneers are impacting the economy and why traditional family dentistry remains vital for our health. So without further ado, let's welcome Dr. Paul to 30 Minutes with dailystraits.com. So first question is, can you elaborate on the key differences between dentistry that focuses on treating dental diseases and dentistry that centers around cosmetic improvements?
Dentistry, as it's always been practiced for thousands and thousands of years, has related to the health of teeth and to remove their ill effects from the overall health of individuals. So if you have decayed teeth, you might have an abscess, and the basic treatment has always been to remove the tooth. And that's how dentistry started. It evolved to trying to prevent teeth from getting abscesses, and that related to two known diseases called tooth decay and gum disease. And so treating gum disease has always been based upon cleaning your teeth, either at home with toothpaste or through a dentist by scaling your teeth. And then you have the treatment of dental decay, which evolved into creating dental drills and fillings and things like that. As people lost teeth, dentistry further branched into technical dentistry, which is more to do with giving tooth replacement, which is dentures, and then individual teeth with partial dentures. And that's a tradition. That's the basis for how dentistry is practiced. So that's the healthcare benefits of dentistry. It's the regular review with the dentist of your health, dental health, so that you don't need to lose teeth. But increasingly, as just the 20th century, really, and this century certainly, there's a preoccupation with the smile and how the smile itself can be managed by the same dentist using fillings and dentures and so forth to be able to give you a better smile. And that's considered cosmetic dentistry. So that includes orthodontics, it includes veneers, it includes teeth bleaching, things like that. But fundamentally, they're not traditionally seen as therapeutic dentistry. It's seen as cosmetic dentistry. So you have the division of the two types.
Okay, so Doc, how are the rising costs for cosmetic dental procedures like whitening and veneers affecting the overall costs of healthcare in Australia? So as we know, dentistry doesn't get any leeway from Medicare, so it's all from your own pocket. So any thoughts on that?
Well, that's because it's not a health intervention. It's not there to make you healthier. Having a tattoo could be considered a health interaction if you want to consider it, as well as a haircut. Simply because it's been performed by a dentist doesn't make it a healthcare service. Medicare only gives procedures and treatments for diseases and for treatments that are directed towards curing those diseases. And Medicare as well gives contribution to the treatment of dental diseases. But those diseases are limited to dental decay and to gum disease. Anything else, it's considered cosmetic, and whether it's performed by a dentist or regulated as only performable by a dentist, well, that doesn't mean it's still a healthcare service.
Okay.
For your health, to improve your health.
So what about the costs? Is there anything that you'd like to talk about the cost? A lot of people are going overseas these days to get their, cosmetic dentals and stuff like that, which is not really good because sometimes they can muck up the service and not give a good service. So any comments?
Sorry,
cost? Is there?
You'll have to explain what is not a good service.
No, sometimes when they go overseas, right?
Right.
The treatment is not done up to par, like what.
Well, yeah, but then, I mean, you have to question yourself whether or not you're seeing a dentist anyway. By that using that title, it doesn't mean that's what they are, and it doesn't mean that they meet the standard of what maybe other countries consider suitable to use that title. If you were to see a dentist in their country, so a dentist who practices dentistry as a self-titled dentist in, say, Bangladesh, would that be the same as somebody who calls themselves a dentist in Canada? And I would say no. But then the consumer, simply by saying I got dentistry and I went to Indonesia, went overseas or somewhere, Cuba, that doesn't mean to say they got dentistry.
Okay, so in what ways has social media contributed to the growing popularity and demand for cosmetic dental services?
Well, no professional promotes their professional practice using social media. I mean, all the information that you find on social media is given by people who are literally not professionals or dentists, whether or not they believe they're credible in terms of providing an opinion based upon what they might read on Google or Wikipedia or whatever, doesn't still make that information valid. So the influence of social media is just people upon people. Liberal Party voters trying to influence Labor Party voters. It's a social population-based thing. It's nothing to do with the professionalism of the profession itself. So if you're having people driven to seek cosmetic interactions overseas because it's cheaper, that's only because it's cheaper than what they may be comparing it to here. There'll be different standards, different materials, different methodologies, different circumstances of the provision of those procedures wherever you go. So a clinic that's 6,000 kilometres away is incomparable to a clinic that's 10 kilometres away from your own. You just can't compare apples to oranges. It's pretty silly for people to go overseas to engage services that they believe to be therapeutic when clearly they're not. They have no rationalism or basis in healthcare whatsoever.
So, Doc, you are a specialist of maxillofacial surgeon. Is that a dental kind of thing? Because it's the first time I'm hearing it.
Right. So clearly maxillofacial surgery does not enter into the pantheon of social media commentary.
So tell me, Doc, what because your specialty is helping people who have giving them a surgical solution for sleep apnea. So which is a big thing because a lot of people are working 24/7 and a lot of screen times and working odd hours and their sleep patterns are all whacked.
The only two diseases that belong to dentistry is gum disease, yes, and tooth disease. That's it. Everything outside of that, every other disease, diabetes, brain tumors, bad knees, every other disease belongs to medicine. And maxillofacial surgery is a medical specialty of medicine. and I treat all the diseases of the neck, jaws, face, bones of the face, sinuses, whatever, skin, just this bit. So it's called maxillofacial surgery.
But let's talk about sleep apnea. How can you help patients who come to you with this problem?
Well, there are many different ways of viewing sleep apnea. The very term itself pretty much defines it. It's the apnea you have when you're asleep. And so it's defined by people who study people when they're asleep, when they're unconscious, and to see whether or not as they're entering sleep, their muscles, we all relax and we don't move, we lose our body tone. And as you lose muscle tone, the muscles within the neck and in the tongue relax as well, and they block off the airway behind your tongue in your upper neck. And when that happens, you can hear it starting. It sounds like snoring, and eventually it blocks. At that point, you don't hear anything because they're not breathing. And so sleep physicians will confirm that you're having sleep apnea, if only just to tell you what you don't know what's happening when you're asleep. So they'll put a mask, which is like a bicycle pump, to inflate your airway so that you can, go into sleep, relax, and still breathe. And that's how CPAP works. It's not a cure. It's just a management system. And their rationalism for it is that they often see it in older people. So they say, well, a factor for developing obstructive sleep apnea is aging and getting older and flabbier around your neck. So we call that laxity, and that could be associated with being a female as well, with hormones. So they talk about a higher predisposition in women, but that I don't believe that's the case. It's just flabby skin. And obesity, so as you get a bigger neck or more fat, the donut hole inside your neck, so that's your neck, the donut hole inside your neck gets smaller. And if it's flabby and smaller and already small, your propensity towards developing sleep apnea is quite high. So in terms of prevention, it's about trying to make that hole bigger so it doesn't collapse. You can't prevent people getting fat, but you can tell them, maybe you should exercise and have a better diet. And you can't stop people aging apart from euthanasia. So at the end of the day, there is no prevention for sleep apnea, but there is if you consider there's another issue, and there's a predominance in the community of people who have overbites. They're cosmetic overbites, and in a non-therapeutic way that's treated by cosmetically to extract teeth to reduce the overbite, or prominent front teeth, or dental crowding, or the anesthetic nature of it. And so it's not treating a disease, it's just treating the cosmetic effect of it through orthodontics. But we now know that dental crowding and bad bites are caused by small jaws, and small jaws we now know are the cause of sleep apnea. So maxillofacial surgeons are unique because we can make jaws bigger, and by making them bigger, you can uncrowd teeth. You can give them the cosmetic effect that they were seeking from the orthodontist without the need of the orthodontist, and you prevent or treat, completely eradicate their sleep apnea.
So, Doc, how many patients do you see in a week?
Well, it's just, you might say, how long does it take for a child to grow into an adult? It takes 18 years, right?
Yeah.
Would you call that surgery by God?
How many people do you see in a week with this problem in Australia?
10.
10. Wow. And And at what stage do you like when they come in? Is it like we have to do the surgery, or you still consult them with medication before they do the surgery?
Medication for what?
Sorry, when they see you, is it straight away you recommend the surgery, or do they have to go through a series of medication or whatever to see if
They've already been through a series over the last
oh,
their entire lifetime of suffering from the effects of having a small jaw. So I'm right at the end of that.
okay.
And they're saying, can you treat me tomorrow? I heard you could cure me. Everyone else has said that they could cure me, but it not been cured. But I heard that you can, and that you can do it instantly. And I go, yeah. And
Wow.
they go, but I've never heard of maxillofacial surgery. And I say, well, that's because we don't advertise on social media. It's just not the way it happens.
So doc, tell me, like, how does this surgery work? You put the patient in anesthesia and you work on them for a few hours, and then can they work after that? Like, can they go back to work?
Okay, so if I get a 12-year-old child that's got this ridiculously small jaw, crowded teeth, they've got a big overbite or whatever, they've often seen ear, nose and throat surgeons because their jaw's so small that they're choking, and they've got big tonsils, or they can't breathe through their nose because they have to breathe through their mouth dependently to hold their jaw forward. So in that circumstance, I just operate on them. It takes about an hour. It doesn't take very long. You might not even call it a real operation. It's just an interaction. It's like cutting your toenails or something. But everyone who doesn't do it says, "Oh, that's invasive." But you go, "Well, you've never seen it before, so how would you know?" You're just fear mongering. But if you put your hands together like that, try it. Yeah. Now pretend you're two halves of an ice cube. Yeah. And you crack it. So you've got a crack in the middle of the ice cube. Yeah. If you float it in water at freezing point, the water will get up inside and the ice cube will refreeze. Yeah. And become whole again. But if you separate it ever so slightly, just a little bit more water gets up inside and it refreezes. Just before it refreezes totally, you open it again and more water gets up inside. And just before it refreezes, you open it again. And gradually you can grow out the ice cube. It's pretty simple, but you can do that to any bone of the body. And all we do is we do it in a very three-dimensional way. We can grow out the face three-dimensionally. It pulls the tongue forward. It opens up the airway. The tonsils now have room. They can breathe through their nose. The jaw's bigger, and they develop all their teeth. They don't get impacted teeth. They get a normal bite. It upsets the orthodontist because they don't have to do orthodontics, and upsets oral surgeons because they don't have to take out teeth. It upsets the sleep physician because they don't have to give them a CPAP. But at the end of the day, you just cure the child. So
forgive me if this is a silly
it takes about an hour.
okay.
Yeah.
Forgive me if this is a silly question, but how do you operate? Do you cut the neck? Do you put a tube inside the mouth? Like, how does this work? And then after the child is done, are you done with the child? Does he have bruises and cuts around the face? Because you said jaw, right?
It's like taking a tooth out at the dentist.
Oh,
It's about that invasive. But it's not. I mean, if you think about it, if you go to a dentist and they take out your tooth, you've lost a tooth. That's invasive. But if I operate, which is less than the operation of taking out a tooth, you get to keep all your teeth. So it's not invasive at all. and by growing the ice cube, as it were, the bones, you're giving tissue. So it's the opposite of invasive.
okay. So after you do this procedure on the child or anyone else, is the cure immediate?
Yeah.
Oh.
Oh, well, they have to grow their jaw at home. They just grow it, but it only takes a week or 2 weeks to grow it
And then no more sleep apnea for life.
for life. Yeah.
All right, Doc, can you tell me how much does this procedure cost? Is it an arm and a leg, or is it affordable, or is it expensive?
Well, because it's a medical procedure performed by medical specialist doctors who are medical doctors in medical hospitals, we have something in Australia called Medicare,
Yeah.
which is what doesn't work in Indonesia, it doesn't work in India, it doesn't work in Bangladesh. It only works for Australians in Australia. And then you've got this other thing called medical insurance.
Okay, so it's paid by that. Okay, that's great because yeah, so
You still have to pay a little bit, but it's like those new drugs that they, $40,000 a tablet. But if you're approved for it, it costs you $5 for the prescription, whatever. It's because it's the Australian system. But that's because it's therapeutic. It's not cosmetic.
okay.
Right? I mean, you can't expect the government through Medicare and medical insurance to pay for cosmetic procedures. Whatever the argument, if you get a tattoo artist says, I'm not doing a cosmetic procedure, this is therapeutic because it's psychologically better for the patient that they have a tattoo, you have to look at them and go, are you nuts? And whether they're a tattoo artist or someone selling you a car or whatever, they're still not medical doctors.
Mm-hmm.
You know what I mean?
Yeah.
So when people complain about the cost of dentistry, it's like you may as well complain about the cost of the Tesla that you want to buy at the car yard, right? You're seeking a cosmetic, non-therapeutic service that, if you want that, fine. That's a free society. But don't put it as a burden upon the rest of us. The problem is that a lot of these cosmetic treatments that are coming about are flowing into Australia. Yeah, they're flowing into Australia, and they become a cost burden because we have to pay for that by foreign trade exchange. So all the coal that we dig up out of the ground and sell to India or Japan or Europe or US becomes a trade deficit, which we don't receive in terms of steel or concrete or petroleum or energy or weaponry or whatever. A big proportion of it is given to us by Allergan for Botox, or Invisalign trays for cosmetic tooth straightening by Align Technologies in the US. Yeah. So the Reserve government basically said, guys, what are you doing? You're all pursuing, cosmetic treatments, utilizing these incredibly expensive offshore products for non-therapeutic reasons. You are contributing effectively to our trade deficit and our inflationary rise within Australia. The Reserve Bank said, cosmetic treatments, you should be thinking carefully about that, including cosmetic dentistry. But they were misquoted. They said, you shouldn't be pursuing dentistry. Well, that's not the case. You should be pursuing dentistry, the normal form of it, the therapeutic form of it. But just like cosmetic surgery in medicine, you shouldn't be pursuing cosmetic dentistry in dentistry. It's just that would be silly, because you're ruining it for the rest of us who aren't so vain and insightless as to the economic effects of that.
I had a bit of a mismatch because I thought you were into dental, but it doesn't look that way. But
no, I told you I'm an expert in all of it.
Yeah. Okay.
That doesn't make me exclusive in terms of my expertise to that one profession.
Okay. So let's I just have one final question. So why is it important to maintain, regular dental checkups and, and how can this help counter?
Regular dental checkups is to prevent the two diseases that belong to dentistry: dental decay and gum disease. That's it. Seeing a dentist to talk about your sleep apnea is like you may as well talk to a brick wall. It's just not going to work. They're not medical doctors. Yeah. You could talk to your tattoo artist about sleep apnea. You could talk to your neighbor about sleep apnea. the insight into it would be about the same.
But how do you get your patients referred to you from the public hospital, or they come to your door and show up? So how does
They
it?
knock on my door, and if I don't answer, they knock again, and they keep knocking.
But do you need to get a referral from the public hospital?
No, you just get a referral from a normal medical doctor called your GP. Everyone should have a GP. Everyone should be looked after by their medical GP. Everyone should have a GP. And fundamentally, if your GP doesn't know that a cure for sleep apnea exists, you just find another GP. But I can't do anything without referrals by medical doctors. Okay. I don't work as a primary medical doctor. I don't look after the medical needs of my patients. I just cure them of sleep apnea, and then they go back to their GP.
And what is the youngest patient you had?
For sleep apnea?
Yeah.
10, 11.
10? Oh, 10.
And your next question would be, what would be the oldest?
No. My next question would be, what is the most challenging one you had? The challenging one you had to fix up, is that going to be?
They're always the ones that have been operated on and been given a go overseas in Indonesia.
Oh, okay.
Or wherever, especially the ones who go overseas and they get cosmetic surgery. Of course, when they fly back and then the complication occurs, the airline won't let them back on the plane to fly back because, they've got a disease.
Yeah.
So they've got to be treated here.
So, Doc, do you treat international patients, like non-Australians with no Medicare?
Yeah, we do that all the time.
So how much is this whole procedure? Is it expensive? Like, can you give a ballpark?
I'm not going to tell you that. It's like, you want to know my wage?
No, it's okay, no worries. But is it
like to know my bank account?
No, is it an expensive procedure? Is it a very expensive procedure?
Yeah, it's hugely expensive.
Oh.
Do you want me to tell you how it's expensive?
No, just give me a ballpark figure, not the whole thing.
I'll tell you. Sleep apnea, right? If you get it, you live 15 years less than everyone else who hasn't got it. That's called all-cause morbidity. There's a cost of being on a CPAP. There's a cost of having obesity. There's a cost of having diabetes. There's a cost of hypertension. There's a cost of looking silly with a small jaw. There's a cost of all the cosmetic procedures like having chin implants or facelifts. There's a cost of nose surgeries to clear out your blocked nose or maybe remove the back of your tongue that's obstructing your airway. There's the cost of the orthodontics, the dental extractions, a whole range of things. And then there's the cost of just dying 15 years earlier. So the real cost of surgery, if you put it together, is equivalent to giving you back 15 years of healthy living. So how much is that worth?
I don't know, 100,000, millions?
Oh, what? So you were alive for 15 years, perfectly healthy, having, a beautiful face, beautiful bite. You keep all your teeth, don't have sleep apnea, don't have obesity, don't have hypertension. That's only worth $100,000 to you.
No, I said $1 million. 100 to $1 million.
Oh, $1 million. Only $1 million now.
Well, yeah. So okay. So it's a substantially expensive.
Well, I would say to you, it's priceless, isn't it?
Yeah, it is. It is.
It would be priceless. Yeah. My job is to preserve the system so as to enable repeat access to that system by people who are legitimately seeking treatment of their conditions. Yeah.
Yeah.
And not just treatment, but ultimately the expression as cure of their condition.
So okay, last question, just absolutely last question. So after they do the procedure with you, you said they take 2 weeks, right, to recover. So during that 2 weeks, are they allowed to work, or are they supposed to have full bed rest?
No, after the procedure, they take about an hour to recover.
Oh, that's
and then we just, look after them for a couple of weeks or days or whatever it is. It's not, you're allowing your imagination to run away with you. I don't personally publish my operations on YouTube.
Mhm.
Yeah, I'm not doing cosmetic rhinoplasties or showing how I do veneers and Botox injections online. That just demeans what I do. I don't explain it except through books and through scientific forums. I certainly try to explain these things to my patients when they present, right? But I've never explained it to you because you've never been a patient, so it remains in your imagination.
Yeah.
We escaped the 19th and 18th century version of surgery around about the 18th or 19th century. You know, surgery belongs in proper medical hospitals by proper medical specialists with proper anesthesia and proper surgical modern methodologies of management and care. You don't get any of that outside of a Western nation like Australia, like the United States, like Western Europe. You know, we have the best technology and the best minds and the best people here. We just don't shout it out to the world because who are we competing against? We're competing against the other guy who's shouting louder. By shouting, all you're doing is falling into their realm of philosophy and self-promotion. Yeah.
Awesome, Doc. So, all right. So that's all that we have for today. This has been a really eye-opening, interesting chat about sleep apnea. So thank you, Dr. Paul, for joining us today and sharing such an invaluable insight